and we've seen how vulnerable and our society is to disruption, and obviously this viral pandemic is one issue, but the global warming is another that is simply not going to go away, and so we need to be able to address this deliberately and carefully. Dr. Mcclure, Dr. Ashley Mcclure, is our speaker today. It's a real privilege to introduce her. She practices adult and family medicine at Kaiser Permanente in Oakland. In addition to her clinical work, she has become a leader in our organization pertaining to global warming and climate change. And beyond our organization, she's also a delegate to the California Medical Association and the American Medical Association. So she's really invested a great deal of herself into this centrally important and existential issue. And so, Dr. Mcclure, thank you very much for joining us, and I'm passing to you.
My pleasure. Thank you. Everybody can see my slide okay?
I can see your slides, yes.
Okay, great. All right, so thank you. I'm really grateful for everybody spending this time with me today, and especially to Jenna and Dr. Prasad and Dr. Singh for inviting me. So in our moment of time, I also want to acknowledge that I am a white physician with significant privilege that still carries imperfect and important blind spots. And my hope is that what I have to offer over the next hour or so invites an inclusive discussion about protecting everyone in our diverse community. So I don't have any disclosures to share, but I'm here to share a surprising turn of events in our professional lives with you. And I have a question for you. What if I were to tell you that the most important use of our medical expertise is not in providing direct medical care? What if there's an emergent use of our professional diagnostic and treatment skills with the potential to save not just one life at a time, but multitudes of lives both today and in the future? By sharing some of my own life story and reflecting on our profession's history, I hope to show you our opportunity for practicing what I'm calling heroic medicine. So I chose to become a physician with the intention to promote health and to heal illness. And after practicing in primary care for 7 years, I went on maternity leave. My unexpected climate awakening came at the end of my maternity leave in November of 2018. During one of my baby daughter's early fall naps, when I too should have been sleeping, I watched the documentary, The Inconvenient Truth sequel. And with the wide open heart of being a new mom, I watched Al Gore recount the scientific consensus of the accelerating global warming and ecological collapse that we are all collectively careening towards. Becoming a mother somehow gave me the courage to face the reality of the climate crisis. With climate grief in my heart and concern for my daughters, indeed all of our children's future, smoldering, my climate call to action was lit by what you probably remember, as I do, of the infamous Camp Fire, the deadliest and most destructive wildfire in California history at the time. The fire that in fact, and perhaps in metaphor, destroyed Paradise, California. For the 13 days preceding the day before Thanksgiving rains, we in the Bay Area were enveloped by the smoke plume from the north. The smoky air made carcinogenic and atherogenic with fine particulate matter. I became a compulsive air quality index checker, and I started monitoring not only our local levels, but wandering the globe's air quality maps and realizing that in India and in China, their air pollution levels are always that bad. From the dirty coal-fired power plants and internal combustion transportation fleets, whose greenhouse gas emissions are also fueling the climate crisis. With my 5-month-old daughter tethered on my hip, tethered to an indoor air purifier, all I could think about day and night was that if we keep warming this precious planet by burning dirty fossil fuels, coal, oil, and gas, we in the Bay Area were living kind of a nightmare preview of what our children's future will become. Sick air, unnatural disasters, and magnitudes of avoidable human suffering and premature death. Suffering that my direct medical care as a physician will be totally insufficient to treat. With a life's work having promised to first do no harm, and a tiny vulnerable human in my arms, with this preview of the sick future that business as usual dirty energy will provide, the cognitive dissonance was deafening. I could scarcely see any way to become the mother or the physician or the human that I want to be without becoming an agent for change in stopping runaway climate change. So I took stock of my tools and my skills, and I asked myself, what do I, as an internal medicine physician with the Permanente Medical Group, have to offer in advancing the climate solutions movement? I think we can all appreciate that for many reasons, physicians play a special role in society. In exchange for our dedication and pledges of beneficence and non-maleficence, we are given a profound privilege of social trust. Privileges give us 3 unique contributions to strengthen humanity's efforts to solve the climate crisis. The first is that we understand and respect science. Our late colleague here, Dr. John Snow, the father of public health, showed how to put science to work in saving lives with preventive medicine by advocating for policies to address the root cause of disease. Without even the benefit of germ theory, Dr. Snow studied the patterns of disease of the cholera outbreak in London in the 1850s. The evidence revealed that patients with dysentery were getting infected from one common well, and instead of treating each individual patient with clinical medicine alone, he practiced heroic medicine in 1854 by advocating to the London City Council to close the contaminated well to stem the cholera epidemic. He saved many more lives with his upstream social advocacy to address the root cause with a new policy than his downstream clinical care ever could have. As physicians, we understand that neither the laws of physics determining the greenhouse effect from burning fossil fuels, nor the rates of exponential infectious disease contagiousness are negotiable. We can only change our response to these facts to cause either more or less human suffering and premature death. So these are all upstream, medicine interventions, and we're all, extremely familiar with the concept of upstream medicine through what seemingly overnight the world understood of the new flattening the curve concept. So sheltering in place to slow COVID-19 spread is an upstream public health measure intended to flatten the curve and prevent overwhelming our downstream healthcare system's capacity. And though we've acted swiftly to an unprecedented public health crisis, there were and continue to be delays. So the emerging evidence about the inconvenient truth of asymptomatic spread and the inconvenient truth of the need for drastic, immediate measures in our entire society was met with significant inertia and resistance. It's impossible to calculate the human toll of that inertia, but models suggest that earlier aggressive action might have saved tens of thousands of lives. The same is true of implementing measures to address the climate crisis. As scientists, we understand that early action, even when it's inconvenient for business as usual, must be used to address public health crises informed by evidence, and that's how we save lives. So our second critical contribution to the climate solutions movement is our uniquely trusted voice. People know that we take a modern day version of the Hippocratic Oath, solemnly pledging to dedicate our lives to the service of humanity and promising that the health and well-being of our patients will be our first consideration. And these promises bear the fruit of trust. So if you poll Americans about the professions they trust the most, nurses repeatedly lead at number 1, but we are a close second, followed by pharmacists. So we as health professionals have the market cornered on social trust. And this trust is a critical tool in the climate solutions movement because the public is faced with a constant onslaught of profit-driven misinformation about the climate crisis. The self-serving interests of fossil fuel companies like Exxon and others have lavishly funded an expertly organized climate denial campaign for the last 30 years, successfully making this physics-based reality of the greenhouse effect more politically divisive than abortion. Big Tobacco funded a similar misinformation campaign, and it took public health advocates like the former Surgeon General, Dr. C. Everett Koop, to overcome lobby interests in the interest of public health. In the wake of the police killings of Black Americans like George Floyd and way too many others, many in our profession are powerfully leveraging this gravitas of our voice. Here we are in Oakland a couple of weeks ago. Using our voice in fighting for health equity and social justice in the White Coats for Black Lives movement. Importantly, this fight for racial justice is integral to that of climate justice, which I think is really well illustrated in this quote by climate and social justice activist Hop Hopkins. You can't have climate change without sacrifice zones. You can't have sacrifice zones without disposable people. And you can't have disposable people without racism. And what he means by sacrifice zones is, like living frontline next to the Chevron oil refinery or the Port of Oakland, places where pollution is unfairly lands. So back to our toolbox and what we have to offer. We here at TPMG are health leaders with a business model that inherently understands the value of prevention. I've heard and I believe that our leaders had an influential input into California's COVID response plan, if not nationally. The TPMG is the largest medical group in the most powerful country in the world. And our mission of improving the health of our members and the communities we serve can be fulfilled by bringing our leadership for health to the climate conversation. So we are the first generation to feel the impacts of the climate crisis with things like annual record-breaking wildfires in our own backyard, requiring the repeated evacuation of our Santa Rosa hospital, record-breaking 100-degree Fahrenheit days in Siberia this past week, floods, and frequent 500-year violent storm surges. We are also the last generation to have the power to cancel climate apocalypse, to flatten the climate curve and prevent runaway tipping points of ecological collapse that will leave our children with deleterious air to breathe while trying to survive accelerating social strife, fueled by food and water shortages and unnatural disasters. And you might be relieved to hear that this is where I return to my promise to share with you our collective opportunity for practicing heroic medicine. This was, I don't know if you may have not seen it, but Dr. Prodi, our AED for government relations and emergency response, who's also an infectious disease doctor, he authored this op-ed in the New York Times last November about evacuating our hospitals and the impact of wildfires fueled by climate change. And I think this is really powerful, that medical evacuees are the new refugees of climate change. So every public health crisis brings the opportunity for heroic healers. Dr. Snow helped to cure the cholera epidemic upstream with policy advocacy. Dr. Koop stood up to big tobacco with science. And I know you have also been a hero clinically in the past few very challenging months in our response to COVID-19. And hopefully you've seen some of these signs in front of our hospitals and clinics when you've been walking to work, thanking you for your heroism in practicing clinical medicine right now. But I have to acknowledge that even in light of COVID-19, global warming poses a threat to humanity on a different scale. It threatens the livability of our entire planet for human beings forever. Which is why the World Health Organization director, Dr. Ghebreyesus, said the Paris Agreement, which the goal of that is to limit global warming to 2 degrees Celsius or less, the Paris Agreement is potentially the strongest health agreement of this century. The evidence is clear that climate change is already having a serious impact on human lives and health. It threatens the basic elements we all need for good health: clean air, safe drinking water, nutritious food, safe shelter, and it will undermine decades of progress in global health. We cannot afford to delay action any further. So the same dirty fossil fuel energy sources that are destabilizing our life support systems and the Earth's climate are also contributing directly to poor health right now through fossil fuel related air pollution, which kills an estimated 7 million people each year. And COVID related deaths are showing us today how the climate crisis helps them or harms the most vulnerable among us first. So a Harvard study in April found that those who are exposed to long-term air pollution at slightly higher levels over time, like, and the air pollution that they looked at was specifically particulate matter 2.5, which you see here on the bottom of the graphic. So PM 2.5, if you're exposed to that at a higher level over time, for each, I don't know, tiny unit of micro, I forget the unit, but for each unit of increase, it's associated with an 8% increased risk of COVID-19 death in the US. This is part of why the age-adjusted COVID-19 death rate for Black Americans is 3.6 times that of white Americans. And it's 2.5 times that for Latin American or Latinos in America than it is for white Americans. Locally worse air pollution patterns, which is illustrated here in the Bay during one of Chevron's disasters. So if you have the misfortune of landing in what's called a frontline community, and you live beside the Chevron oil refinery in Richmond or the Port of Oakland or any freeway in the Bay Area, the air pollution that those communities are breathing is increasing their risk of dying from COVID, and it also reveals who's at greatest risk from getting sick and dying early from climate change. So this connection to the air pollution and climate connection really hits home for us here in California with the air that we are breathing, because California routinely lands 50th of 50 for air pollution in the US. So these kind of overlays of socioeconomic status and where you live and the social kind of strata that make who's getting sick and dying from COVID, there's a ton of overlap between those and who will be harmed most and most quickly from climate change. And this is why many describe the COVID pandemic like an X-ray of society, exposing the deep fractures along socioeconomic and racially filtered social determinants of health. And in an inverse study that Yale did in the past month or two, they looked at the COVID risk in China, and they actually found that the risk of dying from COVID is lower when air pollution is decreased. So because of China's countrywide ban on traffic mobility in February to March, that ban on moving around in cars greatly limited automobile emissions and sharply reduced the country's often severe air pollution. The improved air quality, in turn, prevented thousands of pollution-related deaths. As of early last month, almost 3 times more premature deaths were avoided by cleaner air in China than were lost to COVID-19. Which is pretty shocking. So this data, shocking data, reveals the profound health co-benefits that the clean energy transition needed to solve the climate crisis will offer, and how they'll benefit the most vulnerable among us first. So when you look, at this, any oil refinery or fracking operation here in California, who would you want to be your neighbor? This or this, right? You can breathe easier just looking at the picture. And I think that really, this is one of the most important things for us as physicians and nurses and all health professionals to really powerfully emphasize, is that climate solutions will improve and protect our health in the decades ahead, but they will also improve our health immediately as we stop burning the fossil fuels that have the particulate matter that are making us sick today. So a quote that I like to share, kind of emphasizing this, from Dr. Maria Neira, who's the Director of Public Health from the World Health Organization. And she says, "The true cost of climate change is felt in our hospitals and in our lungs. The health burden of polluting energy sources like coal, oil, and gas is now so high that moving to cleaner and more sustainable choices for energy supply, transport, and food systems effectively pays for itself. When health is taken into account, climate change mitigation is an opportunity, not a cost." So I'm going to do my best now to make a transition. Can you guys see me? Okay, so this brings me to our collective time-sensitive opportunity for practicing heroic medicine. Because of the gravity of the climate crisis, our professional responsibility and opportunity to safeguard health requires that we leverage our uniquely trusted voices and special social trust to influence and raise awareness about how climate solutions are health solutions in order to catalyze public support. No other health professionals can play this role in determining the outcome of the climate story. A fourth-year medical student from across the Bay at UCSF, he captures this perfectly when he said, in a quote, "When clinical medicine can't do any more to help your patient, but society can, social advocacy becomes the standard of care." So we're in an election year, and when people walk into voting booths, they're motivated by protecting their loved ones, top tier issues usually include the economy and healthcare, and for a growing number, the climate crisis. Safeguarding public health requires that solving climate is a top issue for everyone this November. As physicians and nurses, we are expert at motivating behavior change by translating science into a message with personal meaning. For the climate crisis, translation sounds like the climate crisis means worsening asthma for your children. The climate crisis means worse air pollution and heart attack risk for your parents. The climate crisis means well-founded climate anxiety for everybody. So as I suspect you already know, unfortunately, not only is the climate public health crisis existential, but it's urgent. This month, one of the world's foremost energy experts, Fatih Birol, the executive director of the International Energy Agency, warned, "The world has only 6 months in which to change the course of the climate crisis and prevent a post-lockdown rebound in greenhouse gas emissions that would overwhelm efforts to stave off climate catastrophe." So the pressure's on. I'm gonna go back to the, no, present. Okay, can you see my screen again?
Yes.
Okay, thank you. So leading governments are and organizations around the world are mapping out how to build back better with proposals that the International Energy Agency, one example that they just proposed is called the Sustainable Recovery Plan, to boost economic growth for the COVID recession, to create millions of green jobs, and to put emissions into a structural decline through catalyzing the clean energy transition. So this will make energy systems cleaner and more resilient and have immediate and lasting health co-benefits. In May, heeding this call for social advocacy as standard of care and realizing the opportunity to invest in public health by using our COVID response to catalyze the inevitable clean energy transition, hundreds of organizations representing millions of health professionals across the whole world wrote to leaders of the G20 nations calling for a healthy recovery. The very simple ask, which is amazing we have to even advocate for, is that chief medical officers and chief scientific advisors be directly involved in the production of all economic stimulus packages, and that they report on the short and long-term public health repercussions that these may have. So putting public health at the core of our COVID recovery plans. Doing so will inevitably reveal the health imperative of using our COVID recovery to jumpstart the clean energy transition to address the climate crisis. Thankfully, current polls show that the American public supports this. In poll after poll, the results are clear that climate change is one of the most important issues for the election this year. A recent poll revealed that climate is the number 2 issue, second only to healthcare, for Democrats who live in one of the upcoming primary or caucus states. And among all voters, the warming planet is now one of the most salient issues in American politics. And in order for voters to democratically express these historic levels of concern for climate action, we must have a free and fair election this November, arguably the most important election in history in terms of climate and the livability of our planet. So no matter the party affiliation of elected leaders, our collective fate and that of our children requires that every elected official respects science and thus makes climate solutions the top priority in order to prevent runaway climate collapse from stealing the safety of our children's future. So this is why our opportunity for practicing heroic medicine starts with advocating for a free and fair and safe democratic process by using our voice to demand safe elections for everyone this November. I'm sure most of you are aware of what happened in Wisconsin a couple of months ago, where people were forced to go to voting places to vote because there wasn't a mail-in option, and they thus had to risk their health in order to, exercise their right to vote. So this opportunity for practicing heroic medicine starts with using our voice to demand safe elections. And as health professionals, we know that November is going to be a lot like today in terms of the need for social distancing and some degree of sheltering in place. And we don't know what will happen exactly, but it could be the case that November actually sees another surge and things are possibly even worse, like they have been with previous viral pandemics. So this means that protecting public health requires a vote by mail option like we have here in California, but it's required in every state in order to protect our most vulnerable patients, as speaking not just to TPMG, but with our permanente medical groups across the country. This really is a federal issue that we need to engage on. So there's a coalition of health professionals that are organizing around this letter, to implore federal congressional leaders to ensure that no American is forced to choose between their health and their right to vote. I have asked our TPMG leaders if we at Kaiser Permanente can co-sign this letter, and they spoke with health plan colleagues, and I was told that we will not do so. I also have reached out to both CMA and AMA, and because they don't have any policy on election safety in the context of pandemics, they don't have any standing policy to kind of guide signing on to a letter like this. So history has its eyes on this moment of multiple social crises and health crises. This is the time for the medical community, for us in TPMG, the largest medical group in the country. Which side of history do we want to be on? If Dr. Snow or Dr. Koop were practicing medicine today, I know they would be advocating for urgent climate solutions and actually, and by extension, safe elections this November. So Dr. James Hansen, one of probably the most famous climate scientists in the US, he said that we stand at a fork in the road, and we do. When we look back at this climate fork in the road, do we want to be able to say that we as individuals, that we as a medical group advocated for a healthy and fair democratic process in the most important election ever? Do we want to be able to say we honestly did everything we could in advocating for climate solutions to protect the safety of our children when meaningful action still existed? Or that we were too busy with other things? So we have an opportunity to practice heroic medicine. We can improve health today and tomorrow by collectively leveraging our trusted physician and nursing voices to catalyze the collective awakening that the climate health emergency requires, and fostering public support for those solutions. I'm going to close with an excerpt that I've slightly adapted for us as health professionals from a book I very highly recommend called Facing the Climate Emergency by Margaret Kleine Solomon. She writes, "This heroic path is not going to be easy. It is going to be the opposite of easy. But acknowledging the truth of our climate and ecological emergency, grieving the past and the future that have been lost, and taking the heroic path of the health climate advocate will make you confident and strong. It will give you a mission and a purpose beyond anything you have ever experienced before. It will allow you to, at long last, heal your pain and feel genuinely good about yourself. It will connect you to your fellow physicians, and it will connect you to all life. It will give you real, meaningful hope because it is based on your real and incredible potential to affect change. Most importantly, it will give humanity a better chance of canceling the apocalypse and protecting itself and the living world. So I'm going to close for today by inviting you sincerely to join me in this journey. And these are the ways we begin. The first is that you join me in co-signing a pledge of support that I have started, urging that Permanente Medicine makes a policy statement on Permanente action, calling for safe elections this November and a vote by mail option in all states, and that they make that a key advocacy issue for our medical group's lobbyists. The second is to join our Permanente Physicians for Equitable Climate Action team to get updates on our advocacy work and opportunities to collaborate. And so we all have institutional memberships both to AMA and CMA, and I'm just starting to figure out my way around AMA. But within CMA, we have a Google group of concerned physicians, and I would very warmly welcome you to join that. And I'll share this out afterwards, but we have a Google group that you can find. It's called CMA Climate Champions, but the info is here. And then lastly, if you want to join a health professional group outside of TPNG that is advocating for climate solutions to protect health based here in California, I would very strongly encourage you to check out Climate Health Now, and the website for that is climatehealthnow.org to learn more. Lastly, I want to plug the good work that Tad and Nupi are doing along with others on your own San Rafael Green team. So if you want to kind of start local and also work globally with me, you can reach out to Tad Hall or Nupi about the Green team. And that is all I got. So thank you. I appreciate your attention and time, and I hope this was useful, and I would very much welcome people joining in with me. Now I'll be happy to take any questions.
So can you comment on how disinvestment impacts the energy companies, specifically fossil fuel companies?
Sure.
I know this is a complex area because does it actually impact their ability to borrow, which is ultimately what changes their viability as operational concerns? Mm-hmm. Whatever happens in the stock market, does it impact their ability to borrow? And that's what I was hoping to get a sense of clarity from.
Yeah. So divestment from fossil fuels is growing exponentially, and I see it as it's a movement organizing tool for removing the social license of fossil fuels. It's a way to bring into the light the harms of this industry, and it's about making coal, oil, and gas ethically unacceptable to invest in. So I have heard that coal. I mean, we've just seen like fossil fuels prices go negative. So there's also a very strong financial reason to, if you're not looking to lose money, to divest from fossil fuels because it's a dying industry. It's an industry that's dying, kicking and screaming, obviously, but it's very, very not lucrative to invest in fossil fuels. But the divestment movements are not about just pulling away money like in a one-for-one basis. It's about making these investments just like, so this is a good example. For our pension, Kaiser Permanente's pension, we have we have explicit exclusion criteria for tobacco and retail firearms. We don't have one yet for fossil fuels, but those two, it became kind of socially unacceptable to invest and make money on tobacco, especially as health professionals, but across the board it did. And that was a social acceptance or not that impacted our divesting, and that's part of what has pulled away the funding in an important way. It's not the $1 for $1, it's the social acceptance that we're trying to take away.